Hello, hi, namaste everyone. This is Apurva Naik and welcome back to my channel Asane with Apurva Naik. In this particular video, we are going to study about the pharmacology. This particular video is related to the basic of pharmacology. We're going to talk about what is exactly the different branches of pharmacology. So there are the two different branches of pharmacology, pharmacokinetics and pharmacodynamics. So what are they are exactly? It is that we are going to be study in this particular video. Along with that, we are going to be study what is exactly the drugs are. So this is the basic topic that we are going to be covering in this particular lecture. So detail about pharmacokinetics and detail about the pharmacodynamic we are going to be study in the further upcoming lectures related to the pharmacology. So I just want to request, if you like this video and if you see this content is helpful to, don't forget to subscribe my channel. That we are going to be covered in this particular lecture is that what is exactly the pharmacology is. So pharmacology is nothing but it is all about the study of drug molecules. So in the pharmacology, we are going to be study related to the different properties of drug. Along with that, we are going to be study what is exactly the drug effect on body and the body response for the drug. So the all things we are entirely study in the pharmacology. So pharmacology is just not only to be related to the study of drug, but along with that we are going to be studies that how drug effect on a body. Along with that, when the drug come into a body, how a body going to be response for this particular drug, that also going to be studied in the pharmacology. So pharmacology is nothing but it is all about the study of drug, in which how drug effect on a body and how a body responds to this particular drug. That whole thing we are going to be study in the pharmacology. So the pharmacology is a science of drug. In the Greek word pharmakon means drug and logos means discourse in. So simply it is a pharmacology is a science which is related to the drug and the drug studies. So simply we can say about the pharmacology. As we know now what is exactly the pharmacology is, it is simply the study of drug molecule. So we have to know what is exactly the drug molecule is, right? Drug can be broadly defined as it is an any chemical substances, natural or synthetic, which affect the biological system. Means the drug can be any chemical substances which may be a natural means which may be extracted from any plant sources, any microbial sources, any animal sources, or it may be a synthesized in a lab. So it may be any natural or a synthetic substance which can affect the biological system. That particular compound or that particular chemical substances which affect the biological system in a good way, along with that in a bad way also, because the drug not only gives the specific response that we have wanted from the drug, but along with that it's sometimes it may gives an side effect to the body also. So the two main division of pharmacologies are the pharmacokinetics and pharmacodynamics. So pharmacology is divided into the two main branches, that is pharmacodynamic and second one is pharmacokinetics. I just want to summarize this particular slide is that pharmacology is nothing but it is all about the study of drug. In a drug, how drug effect on a body and how body's response to the drug, the whole we are going to be study in the pharmacology. The second thing we are going to be sum up in this particular slide is that what is exactly the drug molecule is. So drug is nothing but it is an any chemical substances, it may be a natural or maybe a synthetic, which affect the biological system. Now we are going to be shift our focus on the two branches, that is pharmacodynamics and pharmacokinetics. So let's see, in the pharmacology definition, we are going to say that it is all about the study of drug. Secondly, how drug effect on body and how body responds to the drug. So one by one, we are going to focus on one topic of each. That is, what is drug is, means firstly we are going to be focused on the drug. Secondly, we are going to be focused on drug effect on the body. So how drug effect on body, and after that we are going to be focused on how body responds to the drug. So these three word we are going to be focused one by one. So first of all we are going to be started what is about the drug molecule is. See, so drug is nothing but in a French we will be say that it is a dry herbs. So it is a single active chemical entities present in the medicine that are used for diagnosis, prevention, treatment, and cure of diseases. It is a single active chemical entity present in the medicine. So I just want to say that ki whatever the tablet that we are going to be eat, it is not just contain the compound that will be cure our disease. Along with that, some binding compound are also present in the drug. So in the whole drug, whatever the single active compound that help to cure our disease, and whatever the purpose that we are going to be taken in the body, that property is only present in that single compound. So that compound, it will be called it as a drug. Means, so in WHO 1966, it will be defined a drug is that ki drug is an any substances or product that are used or intends to be used to modified and explore the physiological system or pathological status for a beneficial of an. There isn't radioactive drugs which are used as a diagnosis purpose. So what are the radioactive isotope is that will be bounded to this specific organ or any tissues or any cell in a body, so that can easily use to diagnose this particular cell, organ or tissue. For this, that is flutimetamol F18, which is help to diagnose the Alzheimer disease and other congenital problems. So that is flutimetamol F18, which is a radio pharmaceuticals, which will be going to be F18, which is actually a radioactive diagnostic agent that are used in PET scanning, or that may be used in PET scan that help to diagnosis of Alzheimer disease and related problem. The second example is barium sulfate, which is a contrast agent that can be ingested by the mouth to help the doctor to examine the esophagus, stomach, and the intestine. Barium sulfate is nothing but it is a white powder, or it may be a thick liquid, which is used in a diagnosis test to help the doctor to examine the digestive tract and identify the problem in esophagus, stomach, and intestine. So barium sulfate is any a radioactive contrast agent, which means it will be coated the digestive tract with the material which is not absorbed by our body, and it is show well on X-rays or it is in a CT scan. So this allow a doctor to see the diseased or damaged area more clearly if we are using a barium sulfate. So this is the two example how we can use a drug for the diagnosis purpose. First one is a flutimetamol F18, which is used for the Alzheimer disease diagnosis, and second one is a barium sulfate, which is used in CT scan or X-rays. Second one is that drug will be using for the treatment purpose. So the most example is that whenever we having a flu, or we doctor will be prescribed an antibiotics. So antibiotics is a treatment that we are using for any bacterial infection in our body. After that, we can use a drug for the prevention purposes also. So mostly for the prevention we are going to take in a vaccines. So for example, we are taking in polio vaccine, we are taking in rubella vaccine. Along with that, some combination vaccines are also there, like MMR vaccines, which is are using the measles, mumps and rubella infection or the prevention purpose. So these are the different types of drugs that we are using for the different purposes. As I previously tell you that the pharmacology which having a two branches. The first one is pharmacokinetics and second one is the pharmacodynamics. So let's focus on what is exactly the pharmacodynamic is. So dynamic is nothing but a power. So what the drug does to the body, that we simply called it as a pharmacodynamics. So in a pharmacodynamics, they're having a D in it. So simply we can remember is that pharmacodynamics is nothing but how the drug, that is D for dynamic and D for drug. So how the drug does with the body, that we call it as a pharmacodynamic. So pharmacodynamic is the study of drug effect. So how drug interacted with our body, that we are going to be study in the pharmacodynamics. So when focusing on the pharmacodynamics, we have to be focused on how the particular drug can be effect on our body. So what is exactly the principle of the drug action? So thing is that the drug, except those gene based, do not impart a new function to any system, organ, or the cell. They only alter the pace of ongoing activities. However, this alone can be have profound medicinal as well as a toxicological impact. You drug the medicine, or when you take the medicine, first one is a desirable effect and second one is an undesirable effect. The first thing is that whatever the effect that we want from the drug, that will be showing by the drug, that we call it as a desirable effect. And second one is an undesirable effect, means when we are taking the drug, that particular drug will showing some of the undesirable effect or undesirable effect in our body, that we call it as an undesirable effect. So let's think about what is exactly the desirable effect is. So first one is a, when we take in a drug for the diagnosis and the drug will be helping for the diagnosis, then diagnosis is a desirable effect. Second one is a prevention, when we take in particularly vaccines for the prevention of particular disease and our body will be prevented for this particular disease, then prevention is a desirable effect. And third one is a treatment, having any bacterial or viral infection and we are taking in any antibiotic or antiviral drug and it's showing their effect, then this particular effect is the desirable effect. But along with this desirable effect, if body having some undesirable effect coming from that drug, then we call it as a undesirable effect. So in undesirable effect, there are some adverse effect, there are some side effect, and there are some toxic effect of that particular drug that are considered as an undesirable effect. For example, if you are taking a drug and we are feel like vomiting, we are feel like uneasy, when we feel like sleepy, so these all are the undesirable effect of that particular drug. So this is all about the pharmacodynamic, means how the drug does with the body, that we are going to be study in the pharmacodynamics. So in the pharmacodynamics, if you are taking the drug and the drug showing some desirable effect, that also we are going to be studying pharmacodynamics. Along with that, if your drug showing some undesirable effect, then that also we are going to be study in the pharmacodynamics. So I hope you are having some idea related to the pharmacodynamics is. So what is exactly the pharmacodynamics is all about. So let's see some example of how the drug can be work on our body. So first one is adrenaline. So adrenaline is a one type of drug that will be interacted with the adrenoreceptor, which are our present on the cell membrane, which is a G protein mediated stimulation of a cell membrane. So adrenaline will be interacted with the GPCR. I hope you might be fair idea about the GPCR receptors, which is a 7 transmembrane receptor, and which will be interacted with the G protein, which are present inside of the cell. So if the GPCR get activated because of the ligand, in this case we have an adrenaline which is acting as a drug molecule, that will be activate the G protein. The G protein will be activate the adenyl cyclase, and adenyl cyclase is an enzyme which convert the AMP into the cyclic AMP. The cyclic AMP, which is a secondary messenger, and that will be showing an desirable effect that we want. So that cyclic AMP will be stimulate the cardiac stimulations, means the person who having an heart attack where their heart is not going well or their heart is not pumping well, at that case we having an adrenaline injections will be provided to this particular patient who had heart is not working well, so that will be increase the cardiac stimulations. So this is a one type of example how the particular drug will be interacted with the receptor and how our body going to be respond to that particular drug. Particular picture, you just get a rough idea about the pharmacodynamics. Let's see that this is the pharmaceutical agents, means any drug molecule. If you are taking a drug molecule for an bacterial cell infections, let's consider that in our body We want to kill the bacterial cells because they are growing in our body, or in anywhere we want to kill these bacterial cells. So how a drug going to be interacted with the bacterial cells? The first thing is that it may be change the membrane integrity. So if the drug molecule will be specific for the membrane integrity, so that particular drug will be changing the membrane integrity, and the membrane integrity will be disturbed, then this particular bacterial cell wall going to be disturbed, cell membrane going to be disturbed, and the bacterial cell going to be burst. The second thing is that it may be interacted with the metabolic enzymes. If the metabolic enzyme, so any one of the metabolic enzymes going to be captured by the drug, so that particular enzyme not going to be working in the bacterial cells, and overall process of the bacterial cells going to be stopped, and the bacterial cell not going to be grow, and that going to be dead. So this type we can going to be means the drug molecule going to be act with the bacterial cells and stop their functions. If we want to take a drug related to the human cells, or maybe the drug will be acting on the human cells, how the drug will be activated in different way with human cells? The first thing is that it may be activate or deactivate the receptors. This is the first way. Second way, it may be interacted with the transporters which are present on the membrane. It may be interacted with the metabolic enzyme, or it may be acting, or it may be changing the action potential of our membrane by interacting with the voltage gated ion channels. So these are the different way where our drug molecule going to be interacted with the human cells and the bacterial cells. This is all about the pharmacodynamics. So now we are going to be shift with the pharmacokinetics is. So pharmacokinetics is nothing but the kinetics means movement. So movement of what? Movement of drug in our body. So that we called it as a pharmacokinetics. So what the body does to the drug. So how our body responds to this particular drug, that we called it as a pharmacokinetics. So pharmacokinetics is an quantitative study of drug movement in, through, and out of the body. Means how that drug will be move in our body, secondly move through the body, and second after that how that particular drug go out of our body. That all we are going to be study in the pharmacokinetics. So it is simply we called it as a, in the pharmacokinetics we are going to be study related to the four things that we simply called as a ADME. A means absorption of drug, D means distribution of the drug, M means metabolism of the drug, that we also call it as a biotransformation of that drug, and E means excretion of that particular drug. This fourth thing we are going to be study in the pharmacokinetics. So let's see. So whenever we are taking the drug in any way, it may be in intramuscular, it may be an oral, so that body should be absorbed in the blood so that it going to be transported in all over the body. So body should be absorbed in the blood. This is the first steps of the drug move in the body. So refer that how the drug get from administration site to the place of action, that we going to be study in absorption. Second thing is distribution. Distribution is nothing but whenever the drug is needed to be, means if I have a headache, so the drug should be going in the head position and show their action. So that we called it as a distribution. So how drug travel via bloodstream to the numerous body region where that particular drug is actually needed, that we called it as a distribution. The metabolism, that we called it as a biotransformation of drug. It is the process that alter the physical and chemical properties of drug within the body to convert it into the more water soluble derivatives. So why it is converted into the more water soluble derivatives is that we want to excrete that particular drug. So if you want to excrete that particular drug in the in the form of urine. So urine is a water, so we have to convert that particular drug in a more water soluble form. So this all processes will mostly going into the liver. So liver is an important organ which are helping in the metabolism of this particular drug. After that, excretion. So it's referred as the process by which medication can be removed from the body. So medication is removed from the body with the help of different forms. It may be in the form of feces, it may be in the form of urine, it may be in the form of sweat. So these are the different forms from which we are going to be excrete that particular drug from our body. So this is all about the pharmacokinetics. So I hope you get all these things related to the pharmacology. What is exactly the drug? What is exactly the pharmacodynamics and pharmacokinetics in this particular lectures? I hope you like this video. If you like this video, then please don't forget to subscribe my channel